This episode of Doc Talk is brought to you by First Bank. We're not just your neighborhood bank, we're your neighbors. Our local team lives up to the name, putting our customers and community first. To experience First Bank difference, stop by any of our 13 Knoxville area locations or visit firstbankonline.com. First Bank, member FDIC.
Hello, my name is Dr. Rob Page and welcome to Doc Talk. Doc Talk is a podcast that is produced by the Knoxville Academy of Medicine and features its physician members giving information to patients that is helpful in terms of making their healthcare decisions. And I feel so fortunate to have with me tonight Dr. Matt Doppelt. Dr. Doppelt is a dermatologist who's been working in the Knoxville area for a very long time. We've been here almost the same amount of time, I guess about 20 years now. We have kids about the same age, and he's been in practice in Southeast Dermatology, and he's here to talk to us tonight about some new techniques and some new technologies in dermatology. Matt, Dr. Doppelt, welcome. I'm sorry, we have a familiarity. We know each other so well, but Dr. Doppelt, welcome. And I guess the first thing that you had mentioned to me that you were going to talk to me about was about treatment of warts. All of us have had warts, or most of us have had warts. And classically, we know that the way is that these things get frozen off, or there's over-the-counter stuff that doesn't really work that well. Tell us what you guys now have in terms of treating warts.
Well, first of all, I'd just say I hate warts, all right? I mean, there's probably not a practitioner out there who doesn't hate it when patients come in with warts. I've had my own sort of personal battle with them. I can remember when I moved here from out of my residency, and I had some warts, periungual warts around the fingers, and it was so embarrassing because I had every tool at my disposal to get rid of the warts, and I just couldn't get rid of them, and it's embarrassing. I'm a dermatologist; I can't get rid of my own warts, right? Anyway, so this struggle has gone on for years now, and the primary way we get rid of warts is typically to destroy the tissue where the wart lives. So this causes a lot of sometimes pain for patients, discomfort, scarring. Destructive method is one way. Another method is to try to get immunotherapy, to try to get the body's immune system to come in and fight off the wart. And we've tried various different ways to make that happen as well. Sometimes successful, but a lot of times not. So I became really interested in this device that's come out called Swift. And it is a low energy microwave device that we basically place on a few of the warts. If you have a lot of warts, you don't have to treat every single one. You can just treat a couple of them. And when you treat these warts, it's a quick treatment, relatively speaking, painless. And instead of destroying the wart, it triggers the body's immune system to come in and fight off the wart. So it's kind of like a little bit of trickery, if you will, immune trickery. But once you kind of get that reaction going where the immune system is fighting off the wart, it actually will go all over and get rid of the warts in other places. And that's why you don't have to treat every wart, because you're, again, getting an immune response going. Oh,
wow. So when you mention microwaves, of course, I think of microwave oven, but this is a different type of microwave. This is not something that's going to heat it up, or, like we think about freezing them off. This is not the opposite of that, which would be heating it up.
Correct. This is a non-destructive method. I've actually used this on myself. I don't have any warts anymore, thankfully, but I've even used it on myself, and it gets a little hot. The application, when we apply it, it's a 2-second burst of this microwave energy. So it gets a little warm, but it's, again, it's not really painful. The treatments, we typically do treatments, it's every 4 weeks, 3 treatments every 4 weeks.
2 treatments every 4 weeks, and this is...
It's one, I said this wrong. Okay. It's 1 treatment every 4 weeks for 3 sessions.
So you would be going for about 3 months. So you'd be going back once a month for about 3 months to get these treatments.
Correct.
Now, in terms of pay, is this something that insurance generally will pay for?
So the issue that we have right now is that we don't really have codes for immunotherapy for warts.
Right.
What we do is we make it almost like a cosmetic charge, and we pay outside of the insurance.
Gotcha. But in the long run, this ends up actually paying for itself, because as opposed to going multiple times getting every single wart frozen off, and which any of us who've had warts know that you freeze these off, or you get one of the over-counter treatments. You're not talking about treating it one time. You're talking about treating it and then it coming back, and then treating it and then it coming back. This you said has a very high cure rate.
Right. Well, the cure rate for this treatment is in reported studies. They've been well designed. We're talking about 85% plus cure rate for the warts after 3 treatments. And then also importantly is a less than 1% recurrence rate of the warts.
Oh, wow.
So it's really significant. And the other thing is, originally they sort of brought this device out, I think, to treat, for podiatrists, because you can imagine when we treat these warts on the feet, a lot of times, they're extensive and, again, a destructive method in that area. I mean, you might not be able to walk on your foot for a couple of weeks, that kind of thing. So, when you think about, downtime, lost work, this is great for kids because they can have their treatment and then they can go and play their sport. So it's just really, I think it's a really interesting way to try to treat these things, and I'm really excited about, about the possibilities.
And and as you said, I mean, not only does this strike me as incredibly advantageous for the cure rate, but also the fact that you don't necessarily have to have every wart treated. That if you're someone who has multiple warts, if you've got them on your feet, maybe your knees, somewhere on your hands, you get a few of these treated, that actually spurs the body to get rid of the warts elsewhere.
That's correct.
That's an incredible thing. So. Well, in addition to the Swift, you mentioned another very interesting technology, which I'm sure will have a lot of application. And you mentioned it's called Quo.
Quo, yes. So Quo is a brand new injectable medication, and it is for the treatment of dimpled cellulite. All right, and so this is the first of its kind. What's interesting about Quo is in a way it's similar to Botox, right? So Botox, before we had for wrinkles, before we had Botox cosmetic, we had other medical uses of this. And then, some pretty brilliant people put it together like, oh, we could treat, wrinkles with this. And now it's become this, this huge thing. So, 90% of women have cellulite. Men rarely get cellulite, but about 90% of women have it. And so far, there's different creams that people have talked about. There's, a lot of different technologies that have come out, but nothing is really long-lasting and effective. And so, and easy to do. And so this is a fairly simple process. We mark out where the cellulite dimples are. We inject the medication. And and that's it. They leave the office. It's a relatively, again, painless procedure. We tell patients there is a significant amount of bruising that happens with this, but that is to be expected. It's the way the medication works. It's actually breaking down the fibrous septa that are tethering down the cellulite.
Oh, wow.
And so it's a collagenase enzyme, or it's actually 2 collagenase enzymes that will actually break those down those fibrous septa.
So if you're talking about like the typical, if you're talking about a typical female who is trying to get cellulite treated, who may have it on the back of their legs or maybe on their behind, and they have a fairly large area, you don't end up injecting a whole lot. You end up only injecting a few areas. Is that correct? Or
so it's the real challenge is like any irregularity, contour irregularity that someone sees on their their backside, they're going to think that that's cellulite, right? So what we're talking about with Quo is true dimpled cellulite. And sort of the way I look at this, and the way you can kind of discern what is skin laxity and what is a true dimple is to actually you kind of lift the skin above where the dimple is, and if the dimple is still there when you lift the skin, that's true dimpled cellulite, and that's where the Quo is going to be great. Now, we do also have in my office some other devices that we can use to actually help tighten the skin or give us some skin laxity improvement. And so I think ultimately, being able to combine both the Quo for the true dimpled cellulite, which is going to give a long-lasting improvement for that, coupled with some skin tightening, I think this is going to be a game changer. Because
there really is no other, I mean, you mentioned creams, et cetera, but this is not, cellulite is something you can't really treat it surgically. You can't do liposuction on it. There are some, I know that there have been some methods here lately, like with cryotherapy or with ultrasonic therapy that have been used to treat fat, but that's not really how you can treat cellulite. That's really to treat more unwanted fat in certain areas. So
That's right. So it's really those fibrous septa that are tethering down the cellulite that are causing that dimpled problem. And what's actually interesting is, because I do some liposuction in my office as well, you can actually make the appearance of cellulite worse when you lipo it.
Right.
And so you've really got to tackle the root cause, which are those fibrous, septa that are there. And there is a device. I actually had it in my office for a little while called Selfina, and it actually would go in and subsize those subsize those septae. But it was a pretty cumbersome process to do,
Right.
and so ultimately, I was like, this is just not going to work out for my patients, and so I was really excited.
And so what could be
to hear
easier
about
than
this
just to
quote.
go in and, just like having Botox injections, now you're getting injections for the dimpled cellulite.
Correct. Yeah.
So well, that's incredible. So no downtime. This is something you might get a little bruising with, relatively painless. Would you need to have multiple therapies for different areas, or?
Great. So the protocol for this is you get the dimples injected once a week once every 3 weeks, all right, for a total of 3 sessions.
Okay.
And maximum or final results are seen at about 10 weeks.
Okay. And so once you've destroyed all this fibrous septae, which is actually creating those little dimples, it takes a few treatments to be able to get rid of that, and then over time to let your body heal and for the skin to tighten up and everything else, you get a maximum result at about 10 weeks.
About 10 weeks. That's right.
That's incredible.
And right now, this is a new medication that's out there. So right now we're talking about at least a year of improvement in this, but again, my feeling after using like the Selfina treatment where you're actually subsizing those septa, you're getting much longer results than a year out. So we just can't say anything more, on label about
right.
it.
Well, because it's cutting edge stuff. This is
Right.
this is absolutely novel stuff. So and what could beat just getting a few injections? Just quick and fairly easy. I can imagine. What would the average appointment time be for a patient to come in?
So it probably takes us more time to take the photos and mark things out, right? Actual injection time, maybe 10 minutes.
Oh, wow.
Yeah, maybe 10 minutes. Yeah, so we're looking at probably about a 30-minute appointment.
So multiple visits, but for very short periods of time and with really good results.
Right,
And with
yeah.
that's incredible.
And the big thing I think with this is that the only real sort of side effect that we get really concerned about is the bruising.
Right.
But we know that it happens. We know that it goes away.
Right.
And so, you wear something that's going to cover it. Wear a sarong around your waist or whatever to, if you want to get that done, during the.
I was going to say, and considering a lot of the other different treatments that exist out there, which actually have a lot more different side effects and can have a lot more recovery time, this seems to be a fairly ideal new technology. So. Yeah. Well, that's incredible. And you mentioned You mentioned a third one, which is actually not something new, but you have a new application for something that you already have used.
Right. So, we're doing a lot more dermal fillers these days.
Okay.
And I think a lot of people know, say Voluma for the cheeks.
Mm-hmm.
So as cosmetic dermatologists, plastic surgeons, we sort of use these things in other areas, maybe off-label from FDA labeling indications. But we now actually have 2 different fillers, hyaluronic acid fillers, that we're now able to treat on label for the chin and chin contour and jawline. So sort of setting the foundation in the cheeks with one of those cheek fillers, and then moving on down to contouring and getting better projection of the chin, which as we age, we get this sort of volume loss, and we also get retrusion of the chin.
Mm-hmm.
And so that's what starts to create that sort of jowling, and the pre-jowling.
Mm-hmm.
And so it's amazing what can be done. I've treated some patients, in these areas. And if I gave you a picture, I'd say, well, what did I do? And you'd say, well, you did liposuction. You did submental liposuction on them. And I'd be like, no, I injected their chin. And you'd be like, this is amazing.
So rather than decreasing down here, you're increasing out here.
Right, because the chin, again, it retrudes over time,
mm-hmm.
and you lose the volume there.
Wow. And so this is a hyaluronic acid filler that's been around for the Voluma, which has been around for a fairly long time.
Right.
A well accepted form of filler therapy. typically used on other areas of the face, but now you can actually use it on the chin on label in order to be able to create this. So the ideal patient would be someone who is just basically an older patient who's starting to, maybe someone who's starting to get, that jowling effect, as opposed to having to go in. Now, I know there's some new therapies for jowls as well, aren't there? There's some new treatments.
Yes.
So go ahead. I'm sorry.
We could do another talk on that
I was
too.
going to say. So I watch a lot of TV. So I just.
I joke. I have a problem. I buy I love the new technology, and I love what it can do, and so so there are some newer energy-based devices.
Right.
There's a device that I have that I just love called FaceTite, which is actually, it's a radio frequency assisted liposuction. And so an hour in my office, and through 3 small openings, like 1.5 millimeters, we can treat this the fat in the submental area,
right,
and along the jawline, and really get some nice skin tightening with that.
But this is another way you could do it. Well, actually, you could probably even enhance those results. Yeah.
Right. So, really when it comes to sort of facial rejuvenation, I kind of look at it, about 3-legged stool is what I call it. And, one of the things is to take care of the pigmentation problems, the fine lines, the wrinkles, textural irregularities. So that's one issue. The other issue is to restore volume that's been lost,
right,
and tighten the skin, right? And so that's where the injectable fillers and something like FaceTite, they're complementary. They really do help each other sort of achieve a better overall aesthetic result.
Wow. So well, some fascinating new technologies and new therapies that we have here. Dr. Doppelt, your office is here in Knoxville, Southeast Dermatology. If I'm a patient, I'm interested in contacting your office about getting one of these new therapies, or getting more information about these therapies, about how to treat warts or dimpled cellulite or the chin fillers with Voluma. How would I contact your office?
Well, so the practice is Southeastern Dermatology.
Southeastern
Dermatology.
Gotcha.
Our main location is right next to the corner of, it's like where Pellissippi and North Shore intersect.
And you can see it from the Starbucks drive-through, right?
That's right. That's right. Yes, if you can find the Starbucks, right there.
Right, but just go to Starbucks and you go right to his office.
Driveway, and I like a nice skinny vanilla latte too, right? No, just kidding.
I'm a nitro cold brew guy, my guy. So.
Right. No, but the location is pretty convenient right there, and my website is www.drdoppelt.com. So that's DRDOPPELT.com.
You'll have that down here at the bottom.
Oh, good. Thank you.
And then, so if I want to get more information, I can go to your website, and we'll have a telephone number. Do you have another office that's available to some patients? So
we do have a satellite location that's down in South Knoxville, kind of where Chapman Highway and John Sevier Highway intersect. It's in the Tenova South building, and we have a presence down there on Tuesdays and Thursdays. I do all the cosmetic work at the main office, because that's where we have all the equipment to do the work. But we also we see the medical patients.
But you have medical dermatology down there, and then that's what you do you do all your cosmetic stuff in the Knoxville location, which is over there in West Knoxville, right off North Shore. And
so at the main office, we medical, surgical, and cosmetic dermatology.
Gotcha.
We've got we like to say we do it all.
Well, thank you so much for joining me here this evening and giving these patients and giving me myself some great new information about new therapies that are available in cosmetic dermatology and treating warts, which that to me is really amazing stuff. So,
well, yeah, I'm excited about some of this this new technology, and you can call and make an appointment for warts, and we come in, and you'd asked about the cost of it.
Right.
If all we do is treat the warts, basically we're not going to sort of have an office visit charge as well. So it'd just be for the treatment of the warts.
Gotcha. And so and like you indicated, I mean, based upon the fact that a lot of times you're going back in for having the same warts treated, years later, days, months later, years later,
time and time again.
This strikes me as just a great way to be able to eliminate a lot of that headache. Yeah. So. Well, that has been our episode of Doc Talk for this evening. Not Doc Talks, Docs Talk, Doc Talk, David, so I get it right this time. Doc Talk is a podcast that is produced by the Knoxville Academy of Medicine and features its physician members giving information to patients that is helpful in terms of making their healthcare decisions. I'm Dr. Rob Page, and thank you so much for joining us.
This episode of Doc Talk is brought to you by First Bank. We're not just your neighborhood bank, we're your neighbors. Our local team lives up to the name, putting our customers and community first. To experience First Bank difference, stop by any of our 13 Knoxville area locations or visit firstbankonline.com. First Bank, member FDIC.